For Primetime Local News, I'm speaking with Dr. Colleen Dell with the University of Saskatchewan. We're speaking on the research showing how dog therapy can help reduce pain and improve well-being for people being treated in emergency rooms. Thank you so much for joining us today.
Thank you for having me.
Of course, we're glad to be able to have you on here. Now, where did the idea come from and how did this all begin to start this research on dog therapy?
Yeah, so we've had therapy dogs in Saskatoon through the St. John's Ambulance Therapy Dog Program now for just over 15 years. And we're always trying to think of places where the therapy dogs can go where people don't have typical access to a pet. And we've been in prisons, senior centers, and addiction treatment facilities and so forth. So the emergency department just became a natural, like, well, I wonder if we should be in there. And we spoke with some of the staff there, in particular, Dr. James Stempian. He's the head of emergency departments for the province and at the RUH where we did our work. And he's like, yes, we should look into this for sure.
Now, since the research has started, how has support been in the process of having this expand to other emergency rooms in the province?
Yeah, it was a large undertaking to do this study. Prior to this one, as a controlled clinical trial, we had two other studies. One, we just interviewed people in the emergency room and said, you know, if a therapy dog was here, would you want to visit? And over 80% said yes. And then we started off with a really simple study where we just took the dogs to see the patients and just measured before and after if there was an impact. And there was, which gave us, you know, the foundation to now do this much larger study where we were able to go in and have a control group who didn't visit with a dog at all. And then we had the group that did visit with a dog. So we were able to compare, and that really gives us real strength in our findings.
And from seeing the success of the research so far and how it's going, are you hoping to expand to other hospitals even across the country?
Yeah, well, since we had started, we were the first emergency department in Canada to have a therapy dog visit. And that was in 2015. I think it was November 2015. And since that time, even when we were releasing some findings, other emergency departments would say, hey, what are you doing there? And so forth. So I think there was 6 or 7 across Canada who have attempted this to date, which is really great. And I love that we've been through all the hard work, like working with infectious disease control to make sure we're doing this in a sanitary way, making sure that we have signage everywhere in case a person is afraid of a dog, right? We want to make sure that we account for everything. We've been through ups and downs and all around. So I think we have so much to contribute if any other hospital is interested in doing this.
And I was hoping we could speak a little bit about the grant that your research team has received from the Royal University Hospital Foundation.
Yeah, so we received a grant from the Royal University Hospital Foundation. So that was a $20,000 grant, which, you know, to do a study is not a huge amount of money, but it is all we really needed. We had such a massive team. We do what is called patient-oriented research. So patients who have experienced the emergency department and with their own pain, having a therapy dog and not having a therapy dog there, they all helped develop the study, right? So that we are making sure we were hitting every angle possible. I have a chair in One Health and Wellness at the University of Saskatchewan, and that chair has contributed to the research that we've undertaken as well.
Why do you believe personally this is so important to have for patients in emergency rooms?
You know what I always say now is if you look over the last 2 years in COVID, and so many people just recognize how important their animal is to their own health and their well-being. So I encourage people to think about that, right? So instead of us thinking about humans to humans helping, there are also help that we can get from animals. And it's a reciprocal relationship. It's not just about them helping us. We're there for their welfare as all. So it's this beautiful reciprocal relationship that we have with animals that I feel we haven't explored, right? We need to do a lot more of that thinking relationship to animals and relationship to the land as well. And I think, again, during COVID, I think a lot of people have kind of expanded their thinking around that. And that's really exciting for me.
I think this is really amazing to see, especially having this opportunity for patients in those emergency rooms or in those situations that, you know, may be terrifying and just having the worst day ever. In those situations that they'll be able to have dogs and pets that can help bring out that happiness inside them that they may have thought couldn't be able to be brought out of them in that moment. Is there anything else you want to add that I may have missed out on based on the research?
No, I just want to add, like Dr. James Stempian, who's the co-lead on this with me, and the head of the emergency department, he always says, you know, coming into the emergency department could be the worst day of your life. It really can be. So how do we add comfort? How do we support patients in that way? And there is a medical team that is there to do that. And the therapy dog can be part of that care team. If it's helping people, we should be doing it, right?
No, that is so beautiful. Thank you so much for joining us once again, Dr. Colleen Dell. And I think this is amazing. I'm happy we're helping get the word out.
Thank you.